When I came to Boston Medical Center, I inherited a bunch of patients from really all over the world. One of my first patients here was a woman from Ethiopia. She was so appreciative of the care that she had received, but even more so was inspired by the fact that I knew her doctor back in Ethiopia. She was so thankful that Boston Medical Center was there, and particularly as arriving as an immigrant.
My name is Boo, spelled B-O-O-H-E. I live in South Boston, Dorchester area on the beach. Kind of reminds me of home because I'm originally from Liberia. Been here now about 20 years. After my mom died, that's when I really fell overboard depression. I was in a bad state. I was walking around like a zombie for years. It came to a point that I thought I wouldn't be cured. I just felt like I had to exist till death. But that's not how I think now at all. Dr. Henderson has spent time in my country. It was very comforting to know that one of his concentrations or specialty was Liberian trauma, victims of Liberian Civil War. And so like that put my guard down, and then I could actually seek help, honestly. My health is much better now before I came in BMC, much better. I never thought of getting a doctor because of race before. So people like to not insist race is a factor. Sometimes it is. And I appreciate that Dr. Henderson did understand my culture and talk to me like he was from my culture.
Many of our patients at BMC are immigrants, refugees. How am I going to approach this person in front of me in maybe a bit of a different way? Because all the literature is just talking about one type of person, one type of clinical setting, without all these other compounding factors involved. How do we collaborate across continents in thinking about Black mental health?
The Africa Global Mental Health Institute is an organization supported by Boston Medical Center. We bring together individual experts, mostly psychiatrists, but also psychologists, social workers, nurses, from approximately 25 countries in Africa and the diaspora, with the focus on how do we improve care for Black people globally.
We are able to facilitate opportunities for healthcare providers to be trained in a way that is more culturally sensitive to the population that they are providing that healthcare to.
I'm Wilbur Harris and I'm from Liberia. The training from Boston Medical Center was very eye-opening and remarkable. They provide financial resources to have lecturers and specialists. We get to interact with professionals from all over the globe at various medical hospitals. There you get to interact and see how psychiatry is practiced in other places.
I've had many different things in my life that would affect my mental health. Many different things. So this is a word for holistic. BMC, they treat everything holistically. The primary doctor's assistant or the nurse ask you if you have food security, ask you if you have housing security, because that's the holistic approach to your health.
It's really a comprehensive program that is very unusual, but Boston Medical Center, once again, is leading that way.
You can be happier, you can become more self-confident, you become more self-aware. And you learn better how to tackle mental health issues.